That's right, guys. This is actually the second similar treatment that the FDA has approved in just the last few months. Now, the first was a type of leukemia in children. This is for a type of lymphoma in adults. It's a way to re-engineer a patient's own cells to turn them into a living drug. At 6'2" and 200 pounds, Chuck Feda was always active, healthy, and loved food. Good thing he's in the restaurant business. But about 3 years ago, he had some back pain that just wouldn't go away.
They found 4 tumors. After they found the tumors and they did a biopsy, they found out that it was large B-cell lymphoma.
Over the next 2 years, Chuck had chemotherapy, surgery, and a stem cell transplant.
And none of that was successful. They were going to do radiation, but the cancer had spread too much.
Facing death, Chuck's doctor found a groundbreaking clinical trial at City of Hope National Medical Center in California. It takes a patient's own white blood cells, a type known as T cells, and genetically re-engineers them into a living drug called CAR T therapy.
The patients who were on these trials came to us with no other options, having progressed with other therapies.
Here's how that re-engineering of the immune system works. A type of white blood cell called T cells are taken from Chuck. Then a virus is used to insert a gene into the cells. That tells the cells to make a receptor that attaches to markers on the surface of cancer cells, allowing the T cells to do what they should do: kill the cancer.
Which gives them hope for not just remission, but hopefully in some cases cure.
The treatment itself can be brutal, setting off something called a cytokine storm that doctors have learned how to control. And now, about a year and a half later,
I'm doing great. I never thought that I would feel this good. And I feel very lucky. I got my miracle.
Now, a similar CAR T treatment was approved for a type of leukemia in kids in August. The key is to find a marker on the cancer cells that can be engineered into the T cells of the patient. Oncologists think that's doable for most blood cancers, such as leukemias, lymphomas, and multiple myeloma, but it won't be cheap.
Yeah.
The manufacturer says this drug, which will be called Yescarta, is going to be priced at about $373,000.
Whoa. For one treatment.
For one treatment. You only need one
yeah,
treatment, but $373,000. The price for the one in children, $475,000.
Is that out of whack for this kind of thing, or is that the norm, or is insurance involved?
There is no norm for this yet. These are all brand new breakthrough drugs. They're still debating or working it out with insurance companies to see what is going to be covered. The child leukemia one, they say that if it doesn't work, you'll get your money back.
Wow.
But that's a lot of money up front.
It's astounding, it is.
Wow.
Yeah, we'll see.
Thank you, Dr. Max.
You bet.